Almost 2 years on from the UK's first national lockdown, Boris Johnson has finally ripped up all COVID-related restrictions in England. So what's changed, what hasn't, and how might it affect you and your wallet? No one will forget the sombre address made by Boris Johnson in late March of 2020.
From this evening, I must give the British people a very simple instruction. You must stay at home.
Now, after months of misery, the Prime Minister has addressed the nation again with a much more optimistic message.
In England, we will remove all remaining domestic restrictions in law.
So, what's new? Well, from now, there is no longer a legal requirement to self-isolate if you test positive for COVID-19. This applies equally to vaccinated and non-vaccinated people, meaning even those unjabbed can go about their business if they test positive. Government guidance will still advise people to stay home if they feel unwell, in the same way that people are encouraged to stay home if they catch the flu. Also being chucked on the bonfire are the emergency powers granted to councils to control outbreaks. As well as those immediate changes, the government has announced a big change to testing, which is earmarked to begin after the worst of winter has passed. From the 1st of April, most Brits will no longer be eligible for free rapid coronavirus tests or the more expensive PCR tests. The free tests will instead be limited to older people, those who are vulnerable to coronavirus, and some key workers. Anyone who gets COVID symptoms while in hospital or high-risk settings will also still be able to get tests. So if you don't fit into any of those categories, how much might you need to fork out? Well, PCR tests, which were previously needed for travel, could cost more than £100 privately, with lateral flows rumoured to cost around £30 for a pack of 7. The changes were met with enthusiasm from the Conservative benches when they were announced in the Commons, but received fierce criticism from Labour leader Keir Starmer.
The Prime Minister promised to present a plan for living with COVID, but all we've got today is yet more chaos and disarray. Not enough to prepare us for the new variants which may yet develop. An approach which seems to think that living with COVID means simply ignoring it. This morning he couldn't even persuade his own health secretary to agree the plan. So what confidence can the public have that this is the right approach?